Jamie County.
Yeah, good morning, everybody. It is really nice to have you all here. Thank you all for joining us. This is very different for us. We weren't actually sure how much time Brexy was going to give us. So now that we're with you, I just want to jump right in because we want to make sure that our special guests have as much time as they possibly can. When the lead pastors were given this opportunity to finish the service today on the theme of hope, it occurred to me that we have some people within our community that all of us would benefit from hearing. And so I'm looking forward to having a hopeful discussion from two of our church members around where we find ourselves in this pandemic. So today we are being joined by Bruce Clark. I know it's only you, Bruce, but your lovely wife, Cindy, is with us in our church community. And Channy Muhn and Krista and family, they're part of our church community too. So we just know that you guys each bring a different perspective of science and medicine. These are two areas we normally don't hear about during a church service. So everybody, I've created some questions to kind of do a loose interview with our friends. Unfortunately, there is little time today beyond these questions for further conversation with your questions and your input. But if you have any questions, please feel free to email me or contact me, and I will make sure that I pass them along to Bruce and Jenny and see what kind of, see if they can do some follow up with you, or I will follow up with you with those questions. So I think that's where we'll start. So Bruce, Jenny, it's good to see you. It's so nice to see you today. So welcome. I'm just wondering, can each of you give us an idea of kind of your professional background and where you're at? Bruce, why don't you start?
Sure, happy to. Thanks, John. So I did my undergraduate and graduate schooling at the University of Toronto. I graduated some time ago from a genetics and biochemistry program and got my doctorate. And shortly thereafter, I went into the pharmaceutical industry, which in Canada was really developing at that time. So I've been a bit over 30 years in the pharma world with big pharma, with biotech, small pharma. And most recently, I was the CEO of a Canadian company called Medicago, which uses plant technology to build and develop vaccines and therapeutic proteins, including the COVID vaccine. So.
Bruce, thank you. Jenny.
Yeah, how does one follow Bruce in any kind of conversation? I would just say that I'm Bruce's underling and I grew up in Ethiopia. No, I'm just kidding. I'm a dermatologist here in Burlington. And so after university, after medical school, I was blessed to get into a dermatology program at McGill. So spent the 5 years doing that. Did another year of sort of skin cancer management, reconstruction, and cosmetic dermatology, and that brought me to Burlington, where I have a practice with a really great partner named Nathan Rosen, and was a surgical consultant at the Cancer Center in Hamilton, and a professor at the university too. But that leads us to today.
Beautiful. Well, thank you guys for taking the time and joining us. Really appreciate this. Let's get started. The subject of vaccines is on everybody's mind right now. So Bruce, vaccines aren't new to us. Can you give us an idea of sort of what the general role is of vaccines?
Sure. You know, in terms of healthcare, there's the aspect of prevention, and then there's the aspect of treatment. And in our Western world, certainly we're lucky to have products that address both aspects of disease, both prevention and treatment. And vaccines fall into the former category in terms of prevention of disease. I mean, this current generation and even my generation has very little experience with many other devastating plagues of the world, from smallpox to polio and so on, thanks to vaccines. They've been very instrumental in wiping out a huge range of diseases that we just don't have to deal with now in a great part of the world. And unlike treatments for diseases, they could probably be considered as harm reduction interventions, and similar maybe to the discussion around seatbelts that was such a big deal maybe 20 odd more years ago, where seatbelts, it was argued that, do we really have to wear them? But I think nowadays nobody argues that you're safer with a seatbelt than without it. And a vaccine is a similar kind of situation. You're least in my view, better off with it than without it in terms of protection from any infection.
Bruce, when vaccines, like, is there I know you don't know a lot of time to go into the complete sort of history of this, but when a vaccine gets approved, we hear a lot of numbers, right? Like especially like 90% or 95% effective, or what some of these numbers. Can you just sort of explain kind of to us, to clarify a little bit better what that all means, and just maybe the approval process and some of those things?
Yeah, it's a good point, and the whole process of drug approvals is actually about statistics. It's applying the statistics, epidemiology, the numbers that come up out of epidemiology, and then comparing those with what would the regulators feel would be a successful intervention in any particular condition. And so I think probably remember early on in the COVID days, the FDA, I think, came out very boldly and said that they would look for a vaccine with 50% efficacy. That means in 50% of the cases, you'd be preventing the disease. When in fact, the products that we're seeing now are much more effective than that, in the 80 to 90% range, which for any therapeutic is a tremendous tremendous accomplishment. But it is, this is one of the things that makes drug development difficult and I'll say, and safer than it certainly could have been, because the statistics are applied and standards are applied that ensure that the safety of a product is not being overlooked just to get the efficacy demonstrated in a particular condition.
Okay, I'm going to come back to you maybe on that a little bit, Bruce, but Channy, just want you to jump in here. What advice do you give to people who still aren't sure whether they should get a vaccine or not?
Well, that's not a loaded question or a polarizing question at all. Thank you for that on a Sunday morning. Well, I think Bruce and I both wanted to say that, everything about today and when we're talking is not advice. It's not medical advice. It's some thoughts of being in the places that we are within the healthcare field, and more about observations, but maybe a little bit of insight as well. I think when you're choosing, like anything, vaccine or no vaccine, we'll use that in this example, it really comes down to how you gather information. Right? I mean, all of these things and everything in life is a choice, and we have to have all of the information available before we can make said choice. So, in information gathering, it's actually quite tricky nowadays, because you can find really good, well documented support for anything that you choose to, any line that you decide to go. And I'll give you an example. Hockey's a big thing in our family. So if I were to look up how many, show me why Korean right-handed defensemen are better than others, right? Like I could find something, and I could find information but that's not appropriate, and that's not global. That's not looking at all the facets of sort of the information that's available. So I think whether you're choosing pro and con or against, you need to make sure that you have reliable info. And I think part of it is about testing that information that you're getting, on either side. When someone is pro-vaccine and we read information, we'll nod our head because it fits our opinion of that. But I should take that opinion from someone, a very, for example, some PhDs and people who are working in the field, and ask myself the question of, what are the hundreds of others of people with the same kind of qualifications? What are they saying? And I think that's one of the better ways to sort of to buffer this, because information can be a pigeonhole, right? We can find one track of information and sort of follow that, and it's tricky. Like it's really, really tricky during this time when there's just information is presented in such a strong and convincing way. So I think if you're at the end of that information gathering, you're a yes, that's great. And if you're a no, I think that's great. I think, as a physician and for the way that I look at information, and this is personal, I trust the hundreds of thousands of people much, much smarter than me who have access to all the information, not bits and pieces of it, to make, a commentary that the vaccines are important and safe. So that's what I would take from my perspective. But again, it's sort of the way that information gathered, right? And people will do that differently. I think behooves us all to try and gather as much proper info as possible.
Okay. I gave you, I guess I gave you a bit of a tough question. And so now it's Bruce's turn.
I know it's coming, yeah.
I know. So Bruce, sort of with what Channy said, I guess part of the question for me is like, we're hearing, a lot of us only hear on the news or hear about different names of vaccines. So is there one vaccine that's better than the other?
Yeah, as they say, the best vaccine, frankly, and I think this is true, the best vaccine is the one you can get, frankly, right now, with respect to COVID. But just to comment on all the vaccines, while they're different companies and different approaches, the fundamental principle on which they act is very similar. And that is getting your body to develop antibodies against a protein that's intimately related to the virus itself. So when you're presented with that virus, your body recognizes it, creates an immune response, and knocks it out. The mRNA vaccines that you hear about, whether it's Pfizer's or Moderna's, they inject preparation of mRNA, which really is a signal, a messenger signal to your body to take certain action. Introduce that and use your body's own mechanism to produce the spike protein that you've all heard about, which is the protein integral to the virus, which your body then creates an immune reaction to and knocks it out. The other vaccines, in principle, while there's some differences, create the protein outside the body, introduce it into the body, but the same thing happens. Your body generates an immune response and so on. So while there's different technologies involved, the principle of immunology is the same in all cases. So it really is, which one can you get as soon as possible to prevent you getting COVID? So whether it knocks the disease out totally and you don't get it, or what we're finding with some of these, as the experience has increased, is that people who do get the infection have a much, much less severe form of it. So in terms of hospitalizations and deaths and complications, those go down substantially when you're vaccinated.
So if there, I'm hearing about this one, and all of us are hearing about this one specific vaccine, AstraZeneca. Did I say the right word? Yeah. Why is there so much pushback on this one in particular right now?
Yeah, the other thing that people need to think about too in this whole process of getting information is this development of the COVID vaccines is unprecedented in terms of time frame. There's never been a point in drug development history where a product has been produced in a year and less than a year and introduced to the public. And so it doesn't mean that the products are any less safe or any less robust. It's just that the regulators, the scientific community, the pharmaceutical business have all worked together to make this process as efficient as possible and incredibly quick. But regardless of how quick these have come into the marketplace, every drug that does get introduced to the marketplace has a period of time where it's then used in uncontrolled circumstances. So these products were all approved based on very tightly controlled, statistically proven criteria for proof of safety and efficacy, as well as quality of the product. But now when they go into general use, some of those controls come off. We have what's called the data sheet or the label, which tells you how to use the product in certain populations, who can get it, who shouldn't get it, and so on. But beyond that, they're not unlike the studies that were used for developing the product, which are controlled, randomized clinical trials under very controlled conditions. Now, when you're introduced to the general population, you have millions of people taking the product under much less controlled conditions. Oversight of a physician or pharmacist or healthcare professional, no question. But the controls that were in place for the approval of product initially are now relaxed because it's been proven to be safe. So now as you go from thousands of subjects to millions of subjects using a product, you start to see side effects that were not visible in smaller numbers of people. This is very common with every product. So what's happening with AstraZeneca is there's some evidence that there's a question about blood clots, which have been demonstrated in some circumstances. but not proven to be associated with the vaccine itself. And so during development and during the regulatory review, there was no evidence that there was a link to blood clots and the vaccine. But now we're seeing blood clots in some cases. Now, what's important to remember is that the population at large, blood clots are going to occur with a certain frequency. So we don't know if the frequency that's appearing is because of the vaccine or whether it's just the normal course of events. And that's why all the regulators took such a pause. And the fact that the big regulators in Europe took a pause, then others around the world said, well, maybe we should take a look as well. And now what you're seeing is they're gradually coming back online after they're satisfying themselves that they understand what's going on. But this will continue to happen. You know, look at any product that's advertised, see the ads on TV. There's about a 2-second statement about how the product works, and then there's a 5-minute blah, blah, blah about what the risks are. Yeah. So that's what you're seeing, and you're seeing this develop in real time, given the accelerated process of development of these vaccines.
Good, thanks. Jenny, I want to come back to you. Even though it's first day of spring, we've come through winter, just a sustained period for a lot of people in isolation, and there's just been a really substantial and adverse sort of mental toll that just individually and as a community that sort of we've been under. And so I just want to know how you guys handling the pressure, like you and maybe your family. And then if you don't mind, like also commenting on if others are coming to you or even patients are talking to you about this, is there any advice you're giving them? Or is there any advice you could give to us in our church as they might be feeling the same adverse sort of feeling mentally? You're on mute. And you sounded really good.
Yeah, I was going to say, I should keep him on mute more often.
I saw a lot of people clapping when I was on mute, Linda Delapaz, and that's not okay, okay? But it's, you know, all joking aside, the mental toll, I mean, I think it's immense, and we see it in a lot of different facets. Most of us aren't even going to see the true toll that it's taking. But we hear stories on stories of, you know, over time of how people are dealing with it and how people aren't dealing with it. I'll start personally. You know, I have a beautiful bride. My wife is, you know, sort of centerpiece of our family, and I have amazing kids. And it makes a difference. It really makes a difference when you have someone who's just, you know, an optimistic and outward other-centered kind of person. We try and have, you know, my sister's family is great. I'm so blessed with the people that I work with. I have a great partner, great teammates at work. And it's sort of been, you know, what kind of community we surround ourselves with. The home, you know, we hear about home church, but really during the COVID time, this home church, I mean, they're some of my deepest friends. Have played a huge role in at least being able to be hopeful, right? Sharing the battles, but being about things. There are other things that you do, you know, there's fitness and there's nutrition, and but for me, you know, I've only been a Christian 10 years, and that journey has been an interesting one with a lot of ups and downs, and I attack it very imperfectly. But I find that the nice time, you know, something nice during this COVID time has been an ability to have more of an awareness of God, and trying to focus on what God's heartbeat is, right? And it always seems to fall on trying to be other-centered. I mean, we have some crazy, amazing, and I say crazy in a positive way, amazing people in our church. I mean, there's so many role models for me in our church, just amongst our smaller Burlington community. I mean, we'll hear from some of them too, like the Newfelds are you know, such leaders in our church, and we'll see. And we move these things towards hope and conversation, etc. It gets a little tricky though when you say, well, what's the advice to somebody else? I would say the same things, but people come from very different scenarios. You know, you can say, well, be in community, find your strong home church and friends, love your family, find your pace with God, nutrition fund. But that's not the reality for a lot of people out there. And that's a learning that I've seen sort of as being a physician and having medically confidential appointments with people, that the toll that it takes. Lots of people don't have access to fitness or money for nutritious food or friends or, you know, are in really tough domestic situations. So that one's a tough one, but I think it always falls to, you know, if you can find someone that you trust, that you can at least come in tune with, that's the starting point. But I don't want to pretend that this kind of advice can address all the really important issues that are happening. But when you hear about mental toll, when you read about the news, I think it's very, very real, right? I think it's, and we all perceive it differently within our lives, but I think it's a pretty huge thing out there.
Janina, that's really good. Bruce, just wondering, can you comment on that as well? How have you guys been handling, you and Cindy, handling things?
Well, I have to echo what Channy is saying in terms of the relationship and Cindy and I having each other at this time has been a huge part of the, say, the ability to cope and to partner together, especially when we're separated from our family, our kids, our grandkids, and so on. I think we probably shared a better time together through this period than we have in many, many years. And I'm thankful to God for that blessing in my life, and then finding a way to keep a positive energy in your worldview and the things that you're able to do. There's a lot of things we're not able to do, but there's still things we are able to do beyond Netflix. In terms of reaching out and echoing what Channy said, we've got so many incredible people in our church family, this small community, that reaching out and appreciating that network at home church in a way that we didn't before, maybe took it for granted before, has been a real benefit to us as well.
That's really good. Hey, Bruce, one thing I did forget to ask from a vaccine perspective is when we do get our vaccines, is this going to be like a one-time, like only in, I know some people we have to get, or depending on the vaccine, maybe 2 doses of something, but is this a one-time 2021 thing, or is this something that will need annually, something like, as we've heard in the past, like a flu shot?
My guess, and this is only a guess at the moment, but from the way the patterns are developing, I would suspect that at least for a number of years, this would be an annual shot. So the good news about that is that we've really understood how to do that from the flu vaccine, which changes every year. The direction from the WHO, depending on what strains are prevalent in which jurisdiction and what timing and so on, we adapt the vaccine on an annual basis. And the same thing is true for COVID, is we can identify the variants. The good news is we do know the variants. And the other good news, I'll speak for the company I know, Medicago. I think on the shelf we had about 30 different variants that were predicted as being possible based on the sequence of the protein and so on, and understanding how the modifications work. And so other companies are doing exactly the same thing. You see that Moderna is already doing tests with their vaccine with the different strains. So I think this will not be a one-time thing. I think it will be for a period of time, annual. And what you're very likely to see is that you'll see a combination of the annual flu vaccine with the COVID vaccine. It'll be one jab.
Interesting.
So, yeah.
Well, that's interesting. Okay, we need to wind down just for the sake of making sure this call doesn't go too long, but I have like tons more questions. But I'm going to ask you, how optimistic are you? And here's the black and white. So Channy, you're going first. Between 0 and 10. Oh, do you have another comment on something else? How about I ask this question, you put it in, and then tell me that, okay? Because I don't know what you're doing. He's frozen. He's pretending he's frozen.
He's pretending
he's pretending he's frozen.
Whatever.
Okay. On a scale of 0 to 10, that being 10 most optimistic, where are you right now, on terms of being optimistic about the future? Channy, you go first.
Bit of a loaded question. I'd say 8 out of 10.
Okay.
That was my number.
Oh,
No.
really?
8.
No.
So then you guys are fairly hopeful about now and the immediate future.
Yeah, I would say, I mean, now it's clearly the toughest, and there's things that we're going to learn on the way. But yeah, I think the things that are happening with vaccines and communities rallying around, how to look after each other. I think that has a lot of important carryover.
That's good. Bruce?
Yeah, and I think there is a solution. We see the solution on the horizon. We don't know how that's all going to play out in terms of everybody getting vaccinated and how it's going to play out here. But we do have a solution. We do know what to do. So unlike other situations, I mean, I think of other situations in past history where the question has been, what do you do?
Hmm.
We don't know the nature of the disease. So we've learned the nature of the disease. We have options for it, and I'm very optimistic that we'll find a way to handle this, and it won't be such a disruptor, and let life move back to normal. It's not going to happen overnight, but it's coming.
Thanks.
You know, the
You
other
guys-
piece to that,
yep.
so the other piece to that is that as Bruce is talking, it made me think, you know, we talk about COVID, but COVID's not the only one out there.
Yeah.
There are some other interesting viruses and infections, and Bruce can maybe not chat about that because it'll scare us. But the
Well,
ability,
thanks for that.
That'll
No,
make
but-
take this out.
no, but this leads to something very positive. This ability to produce vaccines fast,
Correct.
probably one of the most important things I think for our future.
Mhm.
And that's a good point, Channy. What this has done is actually changed. It's accelerated a change that's been coming for a number of years, to speed up the production even of flu vaccines and other vaccines, and gives us a tool. It gives us a tool belt that equips us to be able to tackle other unforeseen things in the future. So you're right, Channy. I agree.
And guys, you're both followers of Jesus. You're both been part of our church. Just wondering how your faith, you incorporate your faith into both personally and professionally in these days that we're in now.
Okay, Bruce, go first.
You know, I think it's not so profound, but I think in the past, my focus has probably been a lot more on others in terms of, you know, telling others what to do and experience and so on. I think the farther I go in life, it's more about me. What do I do? And I think one of the things, especially in my professional life, was to learn how to not make decisions out of fear.
Hmm.
And I think that this whole series on hope and understanding that the hope that Christ is for us is to make sure that, you know, the farther you go in your career and in business, the more senior you go to, the more you're responsible for other people. And so you really do need to be careful that you aren't making decisions from a position of fear, because you make all the wrong decisions.
Hmm.
So in my journey, that's probably been I think part of this COVID time has been part of that journey as well, is to understand what is it to not fear, and Jesus telling us fear not over and over again, and the fact he's with us even until the end of the age. And to understand what that means on a personal level is really changing my walk and my perspective.
Thanks, Bruce.
Yeah,
Channy.
I love that, Bruce, about not making fear your idol, right? Or anxiety or worry your idol, because in this COVID time it becomes so strong. I think, you know, the question about, you know, how do you bring faith into profession, into personal, it bodes the question of a bigger question of, you know, how do I define myself? You know, I define myself as a child of God who's loved by God, who
Mhm.
happens to be a doctor, and who's lucky enough to be a father and a husband, right? I mean, and a friend. So, you know, it's sort of a trick question. The way that we behave, you know, when we listen for the heartbeat of God and try and clearly his heartbeat is for the care of others. I mean, that's a big chunk of it. Is you carry that over into work, and you carry that over into your home life, and you carry it over. So looking for those kind of opportunities, and they don't have to be big and grand. They just have to be tuned in, right? And again, in our church, we have so many amazing role models for me, like that dissolve that divide between person and work, person and profession. And I'm just looking at my screen right now because I have a limited view, but I mean, the Newfelds, holy smokes, the Delapados, holy smokes, the Vissers, holy smokes, right? These are just people who are living in every capacity. And that's, you know, if I pulled up to the full gallery view, I'm sure I could name many people who are doing that. But these are the things that sort of drive, or we don't, you know, what am I defined and who am I defined as, and where does that pour out?
It's beautiful. Thanks, guys. Last question. Promise. Last question. So what are you looking forward to most when things open up more? Bruce.
See my grandkids.
Mine would be
grandkids.
Mine would be
Beautiful.
Bruce's grandkids too.
And actually being able to see a 3D person.
Community in
Supposed to
person is
see.
going to be the biggest one, eh?
Yeah.
You know, Johnny, I can't wait to hug you. You love hugging so much.
I don't like
I know it.
I
Come
don't like
on.
I don't like when you hug me.
I know you don't like when anybody hugs you. So that's, well, maybe your wife, but
You
anyway,
just wear
okay,
your
we'll
mask.
stop
I'm
that
okay.
one. Okay. Okay, thanks, gentlemen. Appreciate your representation of both science and medical perspectives. This information was fantastic. And again, if anybody has any more specific questions that we didn't discuss in this conversation, please send them to me and I will pass them along to Bruce or Channy and we'll give you some feedback on that as well. We have a little bit of time at the end here, and I was in a conversation with the Neufelds, that's Gordon and Sandra Neufeld, and they are, they have been part of the Burlington community for many, 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 many years. They've now moved to Niagara-on-the-Lake a few years ago. And just in our discussion this week, I thought from the theme of hope, you guys have been undertaking, you guys have a home church and you've been undertaking a project. So can you just take a few minutes to sort of give everybody an idea of this project? We'll say hi to everybody first and then give a perspective of this project that you're taking on. It's up, Gordon, Sandra, it's yours.
Well, thanks for inviting us. Even though we're a little further away from Burlington, it still feels like we're part of the same family. And so thanks for having us on. Yeah, we've had some exciting things happen through our home church, and we'll talk. I know, John, I thought we had said 5 minutes. Now it's down to 2 minutes. So I better condense this a little bit, but
it's up to you. Go ahead.
I'm just joking. So we've been starting this card initiative to, or letters to people that we know through the home church group. And I was just trying to think how it evolved. I guess with my work, it kind of brings me into people's homes directly. And so I'm a physiotherapist and I go into people's homes and work with them there, especially people that can't get out. And what's really been interesting is that I've just been noticing such a great, kind of, you guys touched on it before, just a great sense of despair and hopelessness going into people's homes. And I just wrote down a few things that I've observed. You know, people will constantly say, I just don't mentally feel well. I just don't mentally feel well, with tears in their eyes, not really knowing exactly how to express themselves. Or, you know, I have the TV on going 24 hours a day, just so I can hear people's voices. They have to explain why they have the TV going. You know, we don't have any family or friends that live close by, like not really much sense of community. You know, and a lot of them too, this is interesting, they don't have computers. So if they're elderly, maybe they haven't grown up with computers, they don't have computers. So how we communicate doesn't necessarily work for everyone, actually, if we stop and think about that. So, you know, it kind of got me thinking, like, I couldn't, sometimes at night I just lie awake when you hear people's stories and they're crying to you of like how lonely they are. So, you know, we started, I think around Christmas time, I mentioned to a fellow in our home church, one of the ladies that I see, she's celiac and he is as well. And I said to him, hey, could you write a letter or maybe he makes these great gluten-free desserts or whatever. And he goes, oh yeah, let me make something. I'll bake her a gluten-free dessert and write her a little note. And so I brought it to her and like, she just went on and on about this thing. And I was thinking, okay, there's gotta be something to this, gotta be more to this. And then our kids wrote some Christmas cards to a client of mine that hasn't been out since last March, since this whole thing started. No family around really. And she had these cards sitting on her coffee table for like, I would say a month or two after Christmas. And she kept talking about the cards and she responded back to them. So I think that's kind of what got us onto this whole thing of how do we connect with people that, you know, where we don't feel like we, as a group, we can all go in and you know, sort of get into their place. So a girl in our home church group, she decided to, or a mom actually decided to design these cards where she has basically the cards all sort of printed out for most part. And then you can actually write a little thing inside, like a little, is that my writing? That's pretty bad. Huh? You can write a little like note inside to these people. And, you know, it's interesting because as we were doing this, I was reading this devotional and it talked about this fellow named Dr. Jerry Moto. He's sort of a researcher. And he had talked about how that if you send a letter to a discharged patient that had attempted suicide. So some of these doctors were sending letters to these patients that they reduced the chances of reoccurrence in half just by sending letters and following up with people. So I think most of it was letters, but there's probably phone calls, just touching base. But it just kind of shows you how like it could be such a little thing that could just bring so much joy into someone's feeling that's feeling despair, right? Just even like a letter. So I'm just the last little bit, I'll just sort of reflect on a few people. We have a lady, like I said, hasn't been out since March, that we're writing a letter to. We have a mom of one of the couples in our home church group that's kind of isolated in a nursing home. We have a fellow that has cancer, that was basically homeless. He's now living in a somewhat, I guess you could call it, house. And he's sort of, in his last few days of life, and we're bringing meals and writing notes to him and encouraging him. And so, those are just some examples of where these notes are going to. And, I kind of think of even, when Jesus was meeting with I think he met with 10 men with leprosy in Luke, and he healed them, and one came back and praised him, right? So I'm just thinking, like, I don't know where some of this will go, but I do know that Jesus had said to us that your love for one another will show that you're my disciple. And so I'm hoping just these little insights of hope into people's lives can make a difference. So yeah, that's what our group's been up to. It's been a little more than 2 minutes there, but
Oh, that's fine. Listen, anytime you guys are joining us, it's always great to see your faces. Christy and I have been at this church 6 years. You guys, when we first came in, the Neufelds were like legends. So your name sort of got to me before like even meeting you. So I know that whatever is happening, I'm so confident that the Niagara on the Lake is better because you guys are there. And you're welcome here anytime and always to make sure that you're always feeling connected. Thank you though for that. Isolation, loneliness is huge these days, and whatever we can do to help other people. And I agree with both Channy and Bruce when we're talking about, like, if there's anything we can do to show that we have God's love in us through Jesus, we can show Jesus' love to others. It's about doing whatever, even the smallest things for other people. I'm going to close in prayer now, and I want to thank all of you for joining us. The verse that we've been kind of using as the theme for this series has been Romans 15:3. Let me remind you what it says. It says, "May the God of hope fill you with joy and peace as you trust in him, so that you may overflow with hope by the power of the Holy Spirit." Let's pray. Lord, I thank you for this time that we've had to spend discussing some very real concerns that we have right now in our country, our city, our neighborhoods, and each one of our families. And so today, Father, we pray for your peace to be real for the people in our church family, for those that are struggling with physical and mental health challenges, for some that are feeling especially vulnerable and isolated and lonely, for families with young and maybe not so young children, that they will be creative in their care for their kids so that they will flourish, and for single moms and dads, that they will grow in their networks of support. And Father, we pray for peace for the people who are within our community that work in a variety of different industries that is supporting people or facing layoffs and financial hardship. Father, we also pray for that you will give us hope for the future. It's so nice to have this great weather so that we can be outside and feel the warmth of our sun. It just feels like a message of hope that you're even giving to us in this weather. And for wisdom for the medical and scientific community in leading the charge to understand this disease and to offer us a better future. And to many that just, again, give hope to those that are working tirelessly behind the scenes to provide a vaccine system where no one is missed or left out. Lord, these are difficult times, but our hope is in you. So we thank you for the love and care for us, even though we don't realize it. We thank you in Jesus' name. Amen. Everybody, thank you for taking the time to join us today. One announcement would be Good Friday, Easter Sunday are coming up. That would be April 2nd and 4th. And April 2nd, we're doing it locally within our Burlington context, and we'll be making sure that we get the links sent to you and make sure those are that's clearly defined for you. It won't be on Zoom. We're actually thinking about doing something with Crowdcast. And then Easter Sunday will be cross-regional through the Meeting House website. God bless you, everybody. Go enjoy this beautiful day. Even just like sit in the sun for a while and just appreciate what God's looking down on us right now. Bless you all. Go in peace.